Hi, my name is Arjun Sebastian. I'm an orthopedic surgeon and spine surgeon here at the Mayo Clinic in Rochester, Minnesota.
And where are you from, Dr. Sebastian?
I originally grew up in Augusta, Georgia, but I was born in Louisiana. I went to high school in Augusta, and that's where my family still lives.
Okay. And what medical school did you attend?
So I went to Case Western Reserve University in Cleveland, Ohio.
What inspired you to pursue a career in orthopedics?
I think a couple different things. I think I had some amazing mentors who got me excited and interested in the field. And I think the neatest thing about orthopedics is we're able to have a direct impact that we can see very clearly on people's ability to function and move throughout their daily life. And so I think that part of it really inspired me and made me interested in orthopedics.
Today I'll be interviewing Dr. Arjun Sebastian. He is an orthopedic spine surgeon here at the Mayo Clinic in Rochester, Minnesota. He's also my preceptor and mentor here through the M Dimensions program that I've been able to get guidance and mentorship under him this summer. Thank you so much, Dr. Sebastian, for joining me today.
No, thank you, Akeem. It's been a pleasure having you with us.
Awesome. So are you ready for the interview?
Let's go for it.
All right. So can you describe your journey into medical school?
Yeah, I was, I think I've always been interested in science and biology. I think those were some of my favorite subjects growing up. And then I think I liked medicine, being able to combine those sort of interests in science and biology with being able to work with people and help people. Growing up playing sports, doing team-based activities, I think I've always liked and appreciated that part of medicine.
Mm-hmm. What sports did you play growing up?
So I played a little bit of everything when I was younger, soccer, and then as I got older, I ran track and cross country, which also ran track in college as well.
Okay, awesome. What events did you run in college?
I did the 800,
okay.
1500, and then sometimes I'd sub in for the 4x4.
What was that experience like in medical school for you in regards to like what type of student you were and what kind of got you to that point?
Yeah, I mean, I think I was really eager. I was probably a little bit on the younger side when I started medical school, so I kind of dove in head first and had a lot of enthusiasm. I think I was a pretty meticulous person in general, so I think the pace and rigor of medical school curriculum suited me. We were at a school where they had sort of more of a problem-based curriculum, so we didn't have as much formal didactics, which meant that a good part of our day was just spent kind of on self-study, and that suited my learning styles. So I thought it was a good fit for me in that case.
And I know, like, medical school, as a medical student right now, we've been told the analogy that it's like drinking from the fire hydrant. There's a lot of information being thrown at you.
Yeah.
How did you go about balancing, I guess, your academics and also keeping the personal wellness at the same time?
Yeah, it's always tough, and I think I tell all the medical students and residents, probably the balance ebbs and flows from time to time. Sometimes you've got it dialed in right. Sometimes you need to spend more time on home life or stuff outside of work. Sometimes you need to be spending a little bit more time with stuff in work.
Yeah.
I think just being conscious of it is probably the most important thing. And then again, coming back to just sort of really being organized with your time. You guys are busy as medical students. I hate to break the news, it only gets busier, and so making sure you organize time, even if it seems silly, structuring time to work out, structuring time to be with your family, and actually blocking that time off, I think is critically important, because for any and all of us, if we want to, we can just be completely absorbed in work 24/7, and I think we all know that that's not healthy.
Right. Going back to your time in medical school, how did you decide that you wanted to pursue orthopedics?
Yeah, I mean, I think I was always passionate about a lot of things, but I think I knew very early on I wanted to do something surgical.
Okay.
So I liked working with my hands. I liked when I had experiences to be in the OR, I kind of enjoyed that part of it. And so I think, that's the biggest decision to make early on, is to figure out if you have any desire to be in the operating room and be a surgeon. And then in terms of what field of surgery, I really liked kind of neuroscience, and I thought at some point I might want to be in neurosurgery, but then when I did my orthopedics elective, I got to work with some really great people, particularly the residents and the attending surgeons at Case Western, and I think they had a big impact in sort of shaping me and making me want to choose a career in orthopedics.
Awesome. A lot of my viewers, they are pre-meds, they're medical students. What advice do you have for them who are currently, in between different subspecialties or specialties in mind? What advice do you have for them as going through this process?
Yeah, I mean, I think that's the hardest thing, and that consumes, I think, a lot of the conversations, especially as you guys get to third and fourth year, obviously. And I would say if there are things you feel like you have an interest in, seek out as much time working with people in those specialties as possible. So whether that be research projects or shadowing in the clinic or going to the operating room if that's your interest. And I think you'll not only find out kind of what interests you from a medical standpoint, but also the types of people. There's personalities in every profession. Figuring out the kinds of people that you like to be around and spend time with is, I think, equally important.
Awesome. I know you had touched a little bit about research. Did you have a mentor in medical school?
Yeah, I mean, I had several, but I think the one that sticks out the most to me was Dr. Nicholas Ahn, who was a spine surgeon there at the time. He was an orthopedic spine surgeon. And he definitely sort of took me under his wing, kind of taught me how to write papers and got me involved in several research projects. And then, I also worked with a PhD at Case Western, Dr. Murakami, who was focused more on sort of molecular genetics and sort of more bench type research. And I worked with him for a summer and learned a lot from him as well.
Okay. How did you go about fostering those relationships and connections?
Yeah, I mean, a little bit of it was just sort of, send out a bunch of emails and see who's interested. So Dr. Ahn, I sort of just reached out to him because I had a sort of an interest in orthopedics and spine surgery. So I thought he might be someone good to talk to. He was younger attending at the time. He was doing a lot of research. I'd kind of worked with him a little bit during my elective in orthopedics, so I kind of knew who he was. And I just set aside a time to sit down with him, talk a little bit. He had some projects that I could get involved with, so that worked out really well.
Okay.
And then, at least at Case, we actually had a dedicated research block, and so I was really interested in doing some sort of bench-type research just to kind of get a sense of what that would entail. And so again, I went to the ortho sort of basic science researchers. There was a couple of guys who did a lot of work with medical students, and Dr. Murakami, again, was kind enough to take me on.
Awesome. We know specializing, a lot of people hear this all the time, that orthopedic surgery is very competitive, right? So how did you go about going through the application process to residency? How was that experience for you?
Yeah, it's stressful, and I think it's stressful no matter what specialty you choose. The reality is, every medical student is a very bright, accomplished person, right? You don't get into medical school unless you are. And so, by default, any specialty, I think, you're competing against very bright, very intelligent people who also want to do the same thing.
Absolutely.
That being said, I think the way I sort of went about it is I just wanted to do as well as I could do at every stage through the process, right? So whether that be your initial preclinical years, focusing in on it, trying to do the best I can, trying to get, do okay on the boards and all of that kind of stuff. On the research side, trying to be as productive as I could. And then the one thing I always encourage all of the medical students is that, even though you want to go into orthopedics or you think you want to go into orthopedics, really dive in when you're on that psychiatry clerkship or family medicine clerkship and try to get as involved as you can and try to learn as much as you can. It's going to make you a better doctor, first of all. You might be surprised that you might have an interest somewhere else. And number three, I think all of us look for that when we're trying to select residents as people who work hard all the time, not just when they think they're being watched, sort of thing.
Right. And where did you go for residency?
So I did my residency here at Mayo Clinic.
Okay. And how was that experience?
Oh, it was fantastic. Obviously I'm partial because I came back here. But I do think it's, probably one of the best orthopedic surgery residency programs in the country. And I think, Dr. Turner, Dr. Barlow, who is now the current program director, have done a great job of creating what I think is a fairly unique program in the sense of our mentorship model and the amount of one-on-one time you get with attendings. I think that is pretty unique to this program that I've not seen really anywhere else.
Okay.
I think our residents have a great work-life balance, which we kind of talked about earlier. And then, the chief here, they get a ton of autonomy to kind of select their schedule, mold their schedule to the type of career that they want to have when they leave.
For the medical students listening out there, what would you say is the most challenging aspect of a residency program?
Yeah, I think, and I think Dr. Barlow, who's our program director, kind of highlights it. It's a weird transition. As a medical student, you're just a student, and so your job is to focus in on all these things that are mostly for your education.
Yeah.
And as you become a resident, you make this transition from you're still learning, and you still have things that you need to learn and tests that you need to take and things that you have to pass. And you're also learning how to do surgery. So you're learning not only a book, sort of didactic thing, but you're learning a technical thing as well. But then on top of that, you have a job, right? And so for the first time, you have a job, which means that you got to show up at X time. You've got to do these things, which are just part of being a resident, being a physician, that we all do.
Yeah.
But managing that balance between, okay, I need to study and learn all the things I need to learn to be a good orthopedic surgeon. I need to practice my surgical skills so that I become a good technical surgeon. And I need to do floor work and paperwork because that's just part of being a resident.
Right.
I think juggling all those things is really the challenge of residency.
Make a really good point. I know in residency, especially here, you rotate in different areas of orthopedics, whether it's joints, trauma, working on the hip, shoulder. What point in time did you realize you wanted to focus on the spine?
Yeah, I mean, I think we get exposed early because as interns, we spend some time working on the spine service and on the neurosurgical spine service, so we get a lot of early exposure. And I think I knew I had some interest in it already. But I think like every resident, as you rotate through the services, you sort of imagine or envision what your career may look like if you chose that specialty.
Right.
I think a lot of it came down to mentorship. And so I think by just natural, no matter how much we try to organize it, I think by nature people sort of pick their own mentors. And for me in particular, Dr. Nasser, Dr. Courier, and Dr. Huddleston, who were the spine surgeons at Mayo at the time, were a big influence on me. They're people who I enjoyed working with, who I learned a lot from, and made me sort of think that I wanted to be a spine surgeon and helped me along through that process.
Got you. And where did you go for spine fellowship?
So I went to Thomas Jefferson University, the Rothman Institute, for a one-year spine fellowship.
And what was the most challenging aspect about that experience?
I think the difference between fellowship and residencies, fellowship is hyper-focused, and it's 1 year. So the pace feels a lot faster. I think the other challenge is now you're also starting to think about the next step, which is becoming an attending. And so usually around that time, you're looking at jobs, you're interviewing while you're in the middle of this busy fellowship. So I think that's maybe the bigger focus when, as a resident, you kind of initially are focused on just, surviving. And then the second part is sort of getting to fellowship. But I think once you're in fellowship, I think a lot of it is, okay, what I want to do for a job, and how am I going to master these skills so that I can go out and do spine surgery, in 3 months or 4 months or whatever it is.
What do you think is the type of mindset a student should have going through residency and fellowship as they're like kind of developing more autonomy within their practice? What is the mindset or the frame of mind that a person should have going through that training?
Yeah, I think I think self-reflection, self-review is really important because even though every residency program has some sort of structured feedback, that is only a small part of really what happens on a day-to-day basis. And so you have to be, you don't want to be hypercritical of yourself, but you also need to sort of be self-aware and say, okay, these are things that I'm doing well, and whether it be research or didactics or surgical skills, these are areas where I'm behind and I want to make up. And again, it comes back to being organized. It's easy to get lost in the weeds with all the things and resources that you have during residency, but dividing it into, kind of the didactic portion of orthopedics, which is I got to learn the stuff I need to learn to pass my boards, the sort of technical portions, right? These are the skill sets I need to master. And then if you have a research interest, kind of what your research goals are, and always kind of being, at least on a regular basis, sort of reevaluating where you're at.
Yeah.
Because certainly at some point, right, in 5 years or 6 years, there's not going to be anybody handing you formal feedback. And the only way you're going to be successful is you've kind of are self-reviewing.
So at this point, you've graduated residency, you finished fellowship, and now you're building your practice. What is a typical day like for you as a spine surgeon?
Yeah, I would say my days usually start early, so I'm usually up early, sometime around 5:30. And I'm not a morning workout person, so I use that time to catch up on emails, catch up on research stuff. And then usually, if it's a surgery day, sometime around 6:30 or so, I show up to the hospital, say hi to my patients, mark them, all that kind of stuff. And then usually the patients are rolling back around 7:30. Sometime around that time period, either the night before or the morning, I'm looking through all my cases, looking through all the imaging, making sure I'm kind of solid on everything that we're going to be doing for the day. Surgery, the day could be anywhere from 5 p.m. to 6 p.m. or even later, depending on what we have. And then after that, I usually go home, work out, have dinner, and then just sort of catch up, and do recreational things for the rest of the day.
Yeah.
On clinic days, it's a little bit lighter for me. So I usually start my clinic sometime around 8 o'clock, break for lunch, and then do an afternoon clinic, which is usually done around 3 o'clock, and then go home and have the rest of the day for kind of whatever I want to do. And I'm usually in the OR about 2 days a week, and clinic about 3 days a week on average.
It's a nice balance.
Yeah, so it's good balance.
That's good. What type of cases do you see frequently most?
Yeah, so a lot of what we do in spine is, adult degenerative spine surgery. So patients with lumbar stenosis or cervical stenosis who either have, cervical myelopathy from spinal cord compression or radiculopathy from nerve compression, or patients who have neurogenic claudication secondary to lumbar stenosis. And so that's probably most of what we operate on. Being at a referral center, we also obviously see some trauma, because we're a level 1 trauma center. We see some oncology, and then we see some infection and spinal deformity. And so, we're lucky to have a really broad practice here where we kind of do the whole gamut of spine surgery.
Yeah.
But I think just like any practice anywhere, a lot of our patient population is degenerative spine conditions.
You just named a lot of spine conditions.
Yeah.
How do you stay on top of the advancements in spine surgery, orthopedic surgery in general?
Yeah, so I think, that's always challenging. I do think being involved in our national societies helps. And so whether that be the Lumbar Spine Research Society, Cervical Spine Research Society, SRS, because, every year they have an annual meeting. Hopefully you present some of your research, and you also see what other research people are presenting. It's a good time to reset, kind of hear what's going on out there, and keep an ear to the ground, so to speak. I think working with residents and fellows is also helpful for me. They ask questions sometimes that I don't know the answer to, or they bring up things that I never thought about, or they read a paper that I hadn't seen. And so I think at an academic center, I also have that benefit as they kind of push us to kind of stay sharp and on top of things.
Is there a particular reason why you chose academics over private practice?
I think for me, I enjoy kind of having obviously a busy clinical practice, but I also enjoy being involved with teaching, with working with residents and working with fellows, because I think that's rewarding. You build sort of a group of colleagues over the years of training residents and fellows who you can kind of lean on and learn things from, and hopefully they learn some from you as well. And working at a place like this where it's not just about the clinical practice, but there's a bigger mission to try to improve patient care and to further patient care at an institutional level. I think for me it was a no-brainer when the opportunity was here to come back to Mayo Clinic. Got you.
What has been the most rewarding part of your career so far as an orthopedic surgeon?
Yeah, I think it's taking care of patients. And it can be from the most complex surgery to the most straightforward surgery. But when you have patients come back at a year or 2 years and tell you how they're able to do things that they weren't able to do before, how they can hold their grandkids or stand up and walk and travel the world, those types of things definitely stick with you. And the Christmas cards and all those things mean a lot to me because it makes you feel like you're doing something good.
Awesome. Are there any particular advancements in spine surgery that you're looking forward to or you're most excited about?
Yeah, I mean, I think from like an information standpoint, certainly, we're all excited to see what sort of this whole breakthrough in AI can do for us, right? And is that going to allow us to select better treatments or manage our patients better in the future because we're going to have the power of artificial intelligence to help guide us? You know, from a technical standpoint, obviously, you know, there's been some foray into robotics and spine surgery. It's still, I think it's in its infancy, but we can sort of foresee being able to do surgeries more precisely, perhaps less invasively, and maybe more safely than we do now. And maybe through approaches or ways that we couldn't even think about, you know, even right now. And so I think robotics, endoscopy, I think all those things are still on the sort of cutting edge and infancy, but I can see them growing probably in the near future.
For sure. No, AI is definitely, everybody's banking on AI right now.
Exactly.
What approach right now do you take when you do patient care, when you're talking to your patients, explain their condition and your surgical steps that you want to take in the operating room? How do you explain that to them?
Yeah, so I always think, especially for a field like orthopedics, showing the imaging is helpful. So I almost always have the MRI or x-rays pulled up. I try to point out the areas of pathology and compare it to the areas where they're normal, so that even a lay person can kind of see the difference between, you know, a stenotic segment and a non-stenotic segment. I think equally important is just sort of counseling and being realistic about expectations, so what to expect in terms of outcomes, understanding risks and complications. And so again, you know, I think one of the things we do well here at Mayo Clinic is we do a preoperative visit with almost all of our patients. So we sit them down the day before surgery, we go over all of that so that, you know, as best as we can, inform patients about what they're getting into the day before.
Are there any particular misconceptions patients have about spine surgery?
I think the most common one is, you know, that it doesn't work, or that you know, there's some, you know, there's something wrong with it if you need a back surgery. I hear that a lot. You know, I had a friend who had a back surgery and it went badly, and they're not doing well. And so I think breaking through some of those misconceptions, I think it's always helpful, especially if it's something bigger, to have them be able to speak to a patient of yours who's done well with the surgery, so that they have, you know, a person that they can reference to. But yeah, I mean, I think there's, you know, maybe some negative, let's say negative publicity surrounding spine surgery, but I think we all know that if we do well-indicated procedures, our patients actually do quite well.
So as a physician, you're always taking care of patients. You're trying to make somebody's life better. How do you stay healthy? How do you take care of yourself as an attending?
I think that's a great question, and I think we all are struggling to figure out that balance. I think just blocking off time, you know, for working out, getting some regular exercise. I think that's going to preserve your longevity, especially as a surgeon, as, you know, being fit and being active. You know, I think the other hard thing is just eating healthy, especially as a surgeon. It's easy to start munching on cookies and chips in the surgeon's lounge, but trying to, you know, eat 3 square meals, take time from the operating room to make sure that you're hydrating. I think those things are important. I think making time for stuff outside of work, not just exercising and eating right, but having interests that you pursue, or activities that you pursue that you like to do outside of work, are really important too.
What hobbies do you partake in right now outside of work?
Yeah, so for me, I mean, I love being outdoors in Minnesota during the summertime. So my wife and I enjoy hiking, kayaking, you know, and those types of things. And then for me, running is a big activity that I like to do in my spare time too. So, you know, I like to train once a year to run a marathon the last couple of years. That's been a fun activity for me. But it doesn't have to be that. You know, we have physicians on staff who play musical instruments at a high level, or you know, rebuild an old car, or whatever it is. I think something that you engage with that is outside of work is equally important for your well-being.
Awesome. That means a lot. Like, work-life balance is definitely important to avoid that burnout that a lot of people might suffer from.
Yeah.
What qualities do you believe are essential for someone who wants to pursue orthopedic surgery?
I think number one is probably a team player. You know, orthopedics is undoubtedly a team sport from start to finish. And I don't mean that you have to be an athlete. I think that's a common misconception, that you have to be a varsity athlete or of an orthopedic surgeon. But what I actually mean by that is, you know, everybody in my operating room is a critical member of my team, whether it be my surgical tech, my surgical assistant, my nurse, our neurophysiologists, our radiology techs. I mean, all these people are critical to doing the surgery, anesthesia team. And, for a resident to be successful, they have to kind of work well with everybody in the team. And so I think that's the most important thing for an orthopedic resident. And then obviously, hard worker, someone who's going to come in here and, apply themselves at a high level, because as you already have mentioned, there's a lot to keep up with, in terms of the education during residency and all the commitments from a service standpoint from the residency as well. And so, team players, people who are hard workers, I mean, that's what we really go after. We can teach everybody how to do orthopedic surgery, if we give it enough time. But we want to hopefully train people who are going to go out there and then make a difference in the field and make the field better. And so
absolutely,
finding those special individuals is kind of our job.
What would you wish you had known before starting your career as an orthopedic surgeon?
Yeah. Gosh, that's tough. I would say, you learn a lot about your field and your specialty going in, and yet nothing really prepares you for all the sort of weird, unexpected things that happen in clinical practice, right? Whether that be issues with patients, complications, interactions with, other people within the healthcare sphere. And so I think that's where I maybe underestimated the importance of mentors. And I was lucky enough to be at a place where I had several senior partners, people who I knew from residency when I came back here on staff, who helped me navigate that, because it can be a very stressful time. And I think, your first year in practice is always the most stressful year. And a lot of times I think young surgeons kind of feel like they're out there on an island. And I think for me, I really valued, in retrospect, being in a place like this where I had so many people around me who were senior surgeons who had experienced it, who could tell me, oh yeah, I had that happen to me once before, and this is what I did. You lean a lot on them in those first couple of years.
Absolutely. This is like a little fun question. If you couldn't have practiced medicine and you didn't choose this route, what other field would you have gone into?
I mean, there's a lot of things I would like to think I could have gone into. Practically, I actually had a huge interest in engineering too. I think I'm sort of a technical person. I always liked math and science, and so, and I went to an engineering school for undergrad. So, I could certainly see myself as either a mechanical engineer or biomedical engineer or something like that. I would love to do a lot of other things. Be an astronaut or something like that, or be a fighter pilot. But practically speaking, probably something in engineering is my guess.
Got you. I can see that. For the viewers right now, any last advice that you would want to give to inspire that pre-med or that medical student that's listening right now?
Yeah, I think, it sounds cheesy, but, kind of enjoy the process. In retrospect, none of the things that seem really critical to the next steps in your life are as important as they are down the road. And so, that exam seemed like a huge deal like today, but in reality, 5 years from now, you're probably not even going to remember what it was. And so I think enjoying the process, because you make a lot of friends and you make a lot of lifelong connections along the way. And so sort of appreciating that you have a group of medical students who are your co-students who are going through this process together. Same thing in residency, just realizing that, yes, you want to work hard and do well and do the best you can, but that, your world isn't over because this one test, didn't end up the way you thought it was, or because you didn't match in the residency program you thought you wanted to get into. Because I've seen all that, right? And I've seen my co-residents and my co-students or medical students, my classmates, that's the word I'm looking for, go through that. And if I talk to them all 10 years later from whenever that was, it's a blip in the map. And so just realizing that it's a wonderful career to be a physician still. And despite all of the things that you get told about burnout and all the negative things, there's still something I think that is rewarding about taking care of patients.
Absolutely. Well said. Thank you so much, Dr. Sebastian.
Yeah, great.
I hope you all enjoyed it. Everyone remember, it's not a marathon nor a sprint, it's a mission to medicine. Thank you so much for
Yes,
joining. Thank you for
wonderful.
coming
Thank
on.
you.
There you have it. That was Dr. Sebastian with his tidbits, advice, and knowledge and experience of what he has undergone and went through his career, and what his advice was to future physicians, orthopedic surgeons out there. Hope you all enjoyed this video. Remember, please like, subscribe, hit the notification bell, and remember, it's not a marathon nor a sprint, it's a mission to medicine.